I deal with people from newborns to elderly. I deal with medical issues, social issues, psychiatric issues, anything and everything, you name it, I deal with.
My week can be really varied. I do 6 sessions, so 3 days a week as a general practitioner, and during those days I will be seeing patients in the morning. We have open access surgery, so you never know what's going to come through the door. As well as my role in general practice, I'm also involved in GP education and medical school teaching as well. So we have students to the practice here and I'm involved in the teaching of those students.
1 day a week I work for the clinical commissioning group. I am one GP that has an interest in commissioning, but in terms of GPs generally, you have plenty of GPs that work for football teams or work in occupational health or in the media. The beauty of GP is it's very, very flexible. So a typical week for me, it can be very different from a typical week from my colleague in another practice.
Obviously this isn't my GP surgery. We're here at Warrington Town Football Club, where I am the team doctor. I turn up about an hour before the match and check in with the players, just make sure if there's any problems people have been suffering with. Throughout all of that time, I'm also on call for the crowd itself. So if there are any medical problems or any concerns, someone will come up to me and often I'll deal with a little something during that time.
The beauty of my job is that I can do pretty much anything with it. I would love to do some more leadership and some more commissioning in the future.
The practice here are very supportive, and also it's very easy as a GP to be able to take on different roles. So I'd like to see myself getting a permanent position as a GP trainer and hopefully one day as a programme director.
The plus points are when you get to really work with someone who's been struggling. Being able to be present in people's lives and provide that continuity of care and in some cases friendship.
It's very rewarding to reassure patients who are particularly anxious, and it's incredibly interesting in terms of the intricacies and the diversity of what you see on a day-to-day basis. People think that general practice is all about coughs and colds, but I can certainly reassure them it is very different to that.
I work with loads of different professionals on a day-to-day basis. The other GPs, nurses and our brilliant sort of reception team.
I have practice nurses, district nurses, palliative care teams within the community. I also liaise a lot with my colleagues in hospital.
You're seeing a patient every 10 minutes and you can see sort of 40 to 50 patients a day in that way. One moment you could have somebody coming in with a new diagnosis of cancer, and the next minute you could be dealing with a patient with a wound infection or a new mum who's just had a baby.
I grew up with my mum as a GP, so I was always very aware of what a role she played in the community. I was just attracted to the idea of being able to help people live their lives and be healthy, and encourage them, when they need a bit of direction in that way.
As I was finishing my degree in history, I was trying to decide what job to do, and I was looking at becoming a lawyer or going into teaching actually. And what I noticed is the friends who had gone into medicine were actually looked like they were going to have much more exciting careers than me. Privileged. I think that as general practitioners you get to make a real impact on your community, and although the role can be really tough sometimes, I've found that actually GP was a brilliant career choice because of the sort of time it gave me for family life.
If you're somebody who's kind of likes to do different things and wants lots of strings to their bows, general practice is perfect for that.